Hi, I am Dr.Neeraj Jain. I am a consultant rheumatologist from Sir Gangaram Hospital, New Delhi. And on behalf of IRACON 2023 and especially from IRACON-TV, I welcome you, Dr. Ramanan. And Dr. Ramanan is a professor of rheumatology at Bristol Children's Hospital and University of Bristol. Welcome, Dr. Ramanan. So, Dr. Ramanan, so we are like on the second day of IRACON, especially we are just in the midway of IRACON 2023. So, just to be very honest, how has been your experience till now for IRACON? Or maybe if I ask, like, what suggestions you want to give to IRACON so that we may improve further?
So thank you very much for having me at IRACON. Absolute pleasure to be interviewed by you, Neeraj. Dr. Jain and I go a long way back. I think IRACON is a fantastic meeting. It caters to the needs of the practicing adult rheumatologist. It also has significant portions of pediatric rheumatology. I don't think I can really say that you can do anything better. And it's such a joy to see some old friends and make some new acquaintances.
Still, if I ask you maybe some practical tips for betterment of IRACON?
If one had to be very critical, then I think having less topics and giving greater chance for interactions, because now there is a desire to pack so much that sometimes it can be very exhausting. While I understand the desire to pack so much information, sometimes the delegates are left with seeing too much and not enough.
That's perfectly fine. So now I have seen that you have been working too much in pediatric uveitis and all that. So what do you think? Like, what is your insights about the future of uveitis patients, pediatric uveitis patients? Like, what do you think? Maybe the new novel therapies, or maybe some novel biomarkers for uveitis early detection and some management. Can you, sir, guide us?
Sure. Uveitis management, both in adults and children, the primary goal must be working in close partnership with our ophthalmology colleagues.
Exactly.
Because it's a condition which we manage, but they diagnose and they continuously monitor. We are unable unless you're experienced in using the slit lamp. So a good dialogue with ophthalmologist is important. In terms of management, we've moved a long way from using steroid drops and disease-modifying agents to now using biologics. Anti-TNF, particularly monoclonal anti-TNF in the form of adalimumab, remains the mainstay. There is promising trials which is happening in the JAK kinase inhibitor space, which, as you well know, the cost implications makes it very affordable, right. But we'll need to see the trial data. But if I was to give key messages, it would be work in partnership with your ophthalmologist, right. Consider early initiation of disease-modifying agent, and early initiation of anti-TNF. In terms of biomarkers, unfortunately, we don't have any concrete biomarkers that we can incorporate it into routine clinical care yet.
Okay, maybe we'll wait for some of them. And on the other aspect, the other chunk of patients you see is JIA. So I just want to find out the new kid on the block, all these JAK inhibitors. Where do you exactly place them? Yeah. Do you think that we should be using them upfront, or you should do you want to be using a second line or a third line therapy in JIA, or any particular subset of JIA you would use upfront?
Well, a very interesting question, really. The pediatric community has been really looking forward to JAK inhibitors because, being oral small molecules, our patient population don't like injectables or infusions. So it's something we waited for long. In terms of its place, we now have data on both tofacitinib and baricitinib in polyarticular JIA. But its place is probably at best after methotrexate or after anti-TNF and methotrexate. In systemic JIA, the trials of tofacitinib and baricitinib are still ongoing, and we are hoping there may be promise because the JAK inhibitors do block IL-6, and currently tocilizumab is the standard of care for Still's disease.
Exactly.
So once we have that data, that might hold a lot of promise. There is a subset of systemic JIA patients who get interstitial lung disease, which seems to be a new development, only noticed in the last 5 years. In that patient population, the JAK inhibitors are particularly helpful.
Yeah, perfect. So now we'll move on to some non-academic part of Dr. Ramanan. Dr. Ramanan, many of maybe knowing her, he's a very cricket-friendly person. And in fact, we happened to be playing a cricket match way back in UK in 2010. So Dr. Ramanan, what do you think? India recently had a wonderful journey through this World Cup 2023. And what do you think that they should have done at the final, which went wrong with them?
No, I think they gave amazing joy to everyone for 45 days, and we shouldn't look at one day's performance.
Yes.
It was good to bring the country together. There was so much joy. And actually, Dr. Jain is a far better cricketer than me. Just to give you a bit of insight, when he was with us in Bath, we have an annual Bristol versus Bath cricket match.
This was
He
lovely.
played for Bath, I played for Bristol. And if my memory serves right, his team won, we lost. So,
That's fine. So just one last question. Who is your favorite cricket player?
well, for me, it would be Rohit Sharma.
Okay, that's great. That's great. I think we'll leave it here. Thank you so much, Dr. Ramanan, for being a part of IRACON TV 2023.
Absolute pleasure. Thank you very much for having me.
Thank you so much.